Thank you very much, everyone, and happy International Nurses Day to everyone. It's really a great honor for me to be invited in your meeting. And I think this just strengthens our collaboration internationally because we are keen in Europe to reach out to other nurses across the globe to make sure that we share best practice and also we learn from each other. So in my session, I was asked to present about the future of endocrinology nursing in Europe. But what I'd like to present mainly is really the current landscape and what we hope to achieve in the next, probably in the next decade in terms of the future of endocrinology nursing. Apologies for missing the first presentation, but I'm hoping that I'm not duplicating anything. For my presentation, I want to look at broadly first regarding the role of endocrine nurses in mainland Europe. And this reflects really what we do, particularly in the UK and in most Central European countries. So endocrine nurses, particularly in the UK, are involved in several roles. Some are heavily involved in diagnostic testing, some are involved in education training, some are involved in running their own nestled clinics, and there are quite a few endocrine nurses who are practicing at advanced level that have their own research project or portfolio of research, particularly those who are working at a consultant level. And majority of the advanced practitioners are working autonomously, and I'll discuss that in more detail in my presentation. In Central Europe, if you become an endocrine nurse, there are 4 key distinct pathways that an endocrine nurse can pursue in their endocrine career. One is a clear, distinct clinical pathway, and this is the concentration of my presentation for the rest of my presentation, because we're talking about a clinical endocrine nurse in here. But the nurse can also pursue a management pathway, and there's a clear trajectory for that, and particularly clear educational route for nurses who are very keen to pursue management routes. Some nurses would like to pursue a clear research route, and some would like to pursue a more academic route. So for the purpose of this presentation, I'd like to concentrate mainly on the clinical route. Now, once an endocrine nurse starts their career in endocrinology, usually they start as a novice, and it doesn't necessarily mean that they are a newly qualified nurse. And actually, in fact, in the UK and most Central Europe, we don't accept newly qualified nurses to start in endocrinology. We want them to have a good grounding in nursing, and usually we don't accept within endocrinology unless they have at least 1 to 2 years experience as a nurse, and hopefully in the field of endocrinology. And when I talk about endocrinology here, because I work in a very large tertiary center, I don't talk about diabetes. Our diabetes is a completely different specialty that is quite huge, and therefore we separated in most UK center endocrinology and diabetes. And certainly I work in a tertiary center where the diabetes specialty is completely separate. So once an endocrine nurse entered in endocrinology, usually they will have 2 to 3 years experience. And the main focus of those nurses is usually performing dynamic function tests or administering endocrine treatment, and mainly concentrating on patient education regarding steroid use, sick day rules, and administering their own medication, particularly for those patients, for example, who are growth hormone deficient. Once they have enough experience, majority of the nurses now will think about specializing. And I'm not sure how common it is in the rest of Europe, or particularly in India, the concept of specialist nurses. So in mainland Europe and in the UK specifically, we have loads of nurses that are called specialist nurses. And there's distinct training route for them to be called specialist nurses in the UK, for example. For them to be able to be called specialist nurses, there are some key qualifications that they need to achieve, and I'll talk to you about that in more detail in a bit. That includes advanced self-assessment, a post-grad qualification specific to their specialty, in this case endocrinology, and majority of the nurses that are called specialist nurses are either pursuing already completed the nurse prescribing. And the main remit is usually they run their own nestled clinic, but the nursing clinic is supervised, meaning there's a named consultant that supervises them. And majority of the nurses who are specialists in that field can prescribe medication, but they cannot initiate the prescribing, meaning a consultant will have to initiate it, and they can continue the prescribing as the patient is being monitored and being titrated in that treatment. And the research component of those nurses within a specialist role starts at this level where they're heavily involved in audits. Once they have enough experience, they then progress to the next stage, which is what we call the advanced practitioner. And again, this is becoming more and more common in the UK, and it is now becoming common in the rest of Central Europe, particularly in the Netherlands and Sweden, and also now starting in France, which is a good news, really. So nurses who are called advanced practitioner would need to have a master's degree qualifications. And on top of that, they also need to have a postgrad qualification in their specific specialty. So meaning they need to have a postgrad qualification in endocrinology, plus a master's qualification in advanced clinical practice. And those are separate training qualifications. And the difference between a specialist nurse and advanced nurse practitioner is specialist nurses are completely autonomous in the UK in terms of their practice. They see their own patients, they see new patients that are referred either by the general practitioner or physician or other specialty. And then they assess the patient from the very beginning, they start the treatment, they order tests. Usually they can order all sorts of investigation, including imaging investigation, MRI, X-ray, DEXA scan, and they can order different endocrine tests, and they follow through the treatment from the beginning to monitoring and through discharge. And nurses working at advanced practitioner level are usually they have their own independent research project. And once nurses are advanced level, usually majority of these nurses, after about 5 to 10 years of being at advanced practice level, will start thinking about a more expert level. And in the UK, this is still in its infancy. In endocrinology, there are only around 3 nurse consultants in endocrine nursing in the UK, and there's 1 in Sweden. So all in all, in Europe, there are only 4 consultant endocrine nurses in Europe. And this is a more advanced and really we're talking about an expert level. So these are nurses who would like to remain clinical and like to maintain their clinical involvement, but also expand on their research and academic involvement without losing their clinical role. So this is completely separate from those nurses who would like to pursue a more academic or research route. So for those who are working as a consultant nurse, for example, like myself, I remain clinical. So 70% of my role is clinical, and then 30% is research. And majority of these nurses will have either already completed their PhD or doctoral. And those nurses who would like to pursue further to become a clinical professor, they will be doing postdoctoral qualifications or activities. And again, the main difference between advanced practitioner and a consultant nurse is, though they are the same in terms of running autonomous nurse-led clinic, consultant nurses are heavily involved in terms of service development and evaluation. So they're the ones who are thinking about what other nurse-led clinics can be introduced, evaluating the existing service, and then making sure that the service are responsive to the demand or to the needs of the patients. And these practitioners or nurses at this level are usually have their own research portfolio or managing other nurses either who are pursuing their advanced practice qualification or those who are pursuing their consultant nurse qualification. If we're going to look at in more detail regarding the training pathway on how nurses in Europe go from being an endocrine nurse to a nurse consultant, there are some key qualifications, and I think we're fortunate in UK in particular that over the years we have developed a clear curriculum, both academic curriculum and practice curriculum, to enable the nurses firstly to gain the appropriate academic qualification, and secondly to gain the appropriate professional recognition for the advancement in their practice. So if we can look at, for example, nurses new to endocrinology, our focus usually when we have a nurse new to endocrinology is to train them to be competent in endocrinology. And we are using the Society for Endocrinology competency framework, and I've forwarded this to Professor Jagan before, and it would be good if you can have a look at this competency. It's a very good document that will guide you on how to train yourself to become novice to expert in all these 13 competencies that are key in endocrinology. And you would see in here, diabetes is not part of this because this is mainly mainstream endocrinology. And We don't have any issue in you translating this. If you'd like to translate this in any of your Indian dialect, we would welcome your contribution in that, so that then that can be recognized. This is translated in 7 different European languages, including French, German, and Russian already, and we're looking at translating this in Chinese as well. So this document will be very useful for your mentors to guide you on how you can improve and develop your competence from being new endocrine nurse to being an expert endocrine nurse in all these 13 different areas or disease areas in endocrinology. Once the nurse is trained and they have enough experience, then usually we will look at that, developing them into specialist practitioner. And to become a specialist practitioner, the nurse needs to complete an advanced health assessment qualification. This is a master's level training where nurses need to go to university for a minimum of 9 months to maximum of 1 year to complete a health assessment course. And it is a prerequisite before they can do the nurse prescribing. So they need to pass the health assessment course, and they will then proceed to nurse prescribing, which again is a master's level qualification, which lasts for 1 year, where nurses need to complete a nurse prescribing training. And in practice, they will be supervised by a consultant prescribing in practice, and they need to complete an assessment of competence in terms of consultation and prescribing. And once they achieve that, majority of the nurses will need to have, for them to be called specialist nurses, they need to have a postgraduate qualification in that specific specialty. So there are loads of postgraduate qualification in different specialist nursing role. We have one in endocrinology, we have one in diabetes, we have one in cardiology. Particularly in endocrinology, as this is the focus of my presentation, there are about 3 universities in the UK who offers a postgrad qualification in endocrinology, which the nurses, if they like to pursue, they can pursue and complete a full master's qualification in endocrinology, and that will give them a full MSc. If they just want a 2-year postgraduate qualification, they will have to complete a 2-year course, and that will give them a postgrad diploma at master's level in endocrinology. Having all these 3 academic qualifications, that will then entitle the nurse to bear that title of being called specialist nurse in endocrinology. And as I mentioned before, if they want to progress further to become advanced nurse practitioner, this one is a bit more strict because there are strict criteria that needs to be followed, and because this is regulated now in the UK and also in the rest of the Europe, particularly in Sweden and in the Netherlands. In the UK, for example, for you to be called an advanced clinical practitioner or advanced nurse practitioner, you need to have a specialist training on your area of specialty. So either a postgrad qualification in endocrinology, if it is advanced practitioner in endocrinology that you are seeking after, you need to have first an advanced postgraduate qualification in that field. And then you need to complete a master's degree in advanced clinical practice. So that's a separate qualification that you need to achieve, a full master's qualification in advanced clinical practice. And there are loads and loads of universities in the UK and in Europe who offers an MSc program for advanced clinical practice. I just want to emphasize advanced clinical practice. We changed the name to advanced clinical practice because this is being accessed as well by non-nurses. So we got pharmacists who are accessing this course, allied health professionals such as physiotherapists, occupational therapists are also pursuing advanced clinical practice qualification. But for nurses, for them to be called an advanced clinical practitioner, again, they need to have a specific qualification, a postgraduate qualification on the area of expertise before they can then proceed to completing an advanced clinical practice course. And for those who would like to pursue the next level, which is the expert level as a consultant nurse, again, majority are completing their PhD. And in the UK, there are several routes by which we can complete our PhD. For those who are keen to maintain their clinical practice, we usually go via the National Institute for Health Research, who offers a clear pathway for those who are keen to maintain the clinical role. And the Health Education England, through the National Institute of Research, offer funding places for nurses who want to pursue their clinical doctoral research fellowship that will give them a PhD qualification at the end of that program. But again, this is not the only route. There are loads of universities offering PhD, of course, for open for anyone who would like to pursue them. Now, just to summarize, this is currently where we are in terms of the UK. Majority of the nurses in the UK are either working as an endocrine nurse and as specialist nurses. We have around probably nearly 100 nurses across the UK, and if we're going to concentrate in Europe, there are around 150 nurses in Europe, estimated 150 endocrine nurses, specifically endocrinology, and working as an advanced clinical practitioner with the right qualification. The future is we're hoping that there will be more and more nurses that will be pursuing a more expert career in endocrinology, where they will have their own research portfolio and supervising more nurses who would like to advance their career. So currently there are very, very few. As I mentioned to you, in Europe, there are only 4 consultant nurses in endocrinology. We have 1 clinical professor in endocrinology in Europe. And again, this pathway is still in its infancy, and we're hoping that as more nurses enter into this level and become more expert, that more nurses will follow, because they know what route to follow in terms of progressing further into an expert role. So this is where we are in Europe, and this is where we are particularly in the UK. Thank you very much.